Hello, welcome back to Iron's Health Talk with Dr. Akram. Today we are discussing about coronavirus and we have a special guest on Skype from Midlands, is Dr. Kamal Abdul Naser, and we've been discussing about basically about how the coronavirus comes here and how does it get transmitted. And next, I think we have touched upon the treatment a little bit because we had a caller online, and here we go. I think let's talk a bit more about the treatment. Dr. Naser, would you like to quickly say a little bit about the treatment? Probably they are at the moment still on study purpose, and I'm sure I think they're not using in general conditions. What are these hydroxychloroquine and azithromycin, and are there any vaccines, things like that?
Talking about these trial medications they are trying in other countries and vaccines they're trying, I should tell all the people living in UK. Currently, if you suspect yourself to be having COVID-19 or coronavirus infection, 80% of the people wouldn't need any treatment. They will recover completely without any problems. They don't need to go to the hospital or GP. Only thing they need is some paracetamol, taken about 2 tablets for an adult every 6 hourly. And make sure that you don't overdose yourself with paracetamol. You shouldn't be taking more than 8 tablets for a person who is more than 50 kilos. And if you are less than 50 kilos, it should be lower dose. And also, don't forget that your fever may be due to other reasons, like you may be having a cellulitis, which is sort of like a red skin in your leg, which can cause your fever, or you may be having a water infection, urine infection, or so many other infections, or you may be having a general chest infection. If you're bringing out a lot of phlegm, a yellowish or a greenish phlegm, then you should think of something else. So you should then call the 111 and discuss that. So that's your general management. 80% will recover without anything. Only 20% are going to be treated in the hospital. And out of that 20%, a very small percentage will be going into an intensive care unit and maybe ventilated, very, very small percentage of people. So essentially, if you are saying what treatment to give, is just paracetamol for normal people. If you are admitted, again, you will be monitored and you will have so many other tests and you will be confirmed whether it's COVID-19. And then if it is proven COVID-19, and you may still not get any treatment. However, in some centers, they may try this hydroxychloroquine as for research purpose. Sometimes it might work, sometimes may not. There's no approval given in this country to start hydroxychloroquine at the moment. And in other countries, they have tried combinations and with azithromycin. So therefore, this azithromycin is an antibiotic. When you combine these 2 antibiotics, there can be sometimes heart problems, which can cause death even in some people. So therefore, we must be very careful not to take any medications without being prescribed other than paracetamol. And people talk about ibuprofen, that's Nurofen, which is over the counter in this country. And there was some talk about ibuprofen can be harmful in people with COVID-19 or coronavirus infection. However, there is no definite data to say that it is a harmful medication in coronavirus. But I cannot assure you there is safety for this ibuprofen. So I would say avoid ibuprofen if you can. Better to manage your headache or aches and pain with paracetamol. However, if somebody is taking cocodamol for a pain relief, you can take cocodamol. However, you should remember that cocodamol has got 500 milligrams of paracetamol in each tablet. So if you can't take a paracetamol tablet and cocodamol tablet, if you're taking cocodamol, don't take paracetamol. because you will overdose yourself and it will cause toxicity and you might end up in the hospital with another problem. Otherwise, at the moment, if you become really sick with the pneumonia due to this coronavirus or COVID-19, or you develop shortness of breath, you will be admitted to a specialized unit and you might even be taken to an intensive care unit depending on the findings. Some people will end up in a ventilator where a tube will be inserted through the mouth and artificial sort of breathing will be given. So that's the very severe sort of level of the COVID-19. So very few people end up in ITU, that means intensive care units. However, because so many people are getting infected, we would see that we will run short of intensive care beds.
Before we go to the next bit, the vaccine, I think it's what I understood is at the moment there is no specific treatment for this disease. Everything what we're doing is still in research level. Is that correct?
Yes.
Okay.
Yes. Yes.
Before we go to the next bit, I would like to remind again for our viewers that we are on live and you could call us on 0203 515 5788 or Sky 782, Facebook /INTV UK, www.in@uk, health talk @intv.co.uk. Please, we're going to go back again. Are there any vaccines at the moment? They've been talking about Chinese vaccine, the American vaccine, and the Japanese vaccine. There've been lots of things going around in WhatsApp messages and everything. Is there anything around at the moment?
Yes, in many places, people are researching to develop vaccines, and even in UK, teams are working around developing a vaccine. However, developing a vaccine is not something which could be done within weeks. You can develop some vaccine, however, it has to be tested, properly tested in animals and then in volunteers, and then it has to be tested in proper patients. So it will take time. So depending on how fast it could happen, it might still take about a year. So therefore, we can't expect a vaccine within a short period. We saw quite a lot of WhatsApp messages showing a box of sort of like 2 bottles and a strip shown in a bottle in a box saying that this is a vaccine, and that's a vaccine. In some WhatsApp post, we saw that it is sent as a treatment which works within 3 days. And there were lots of WhatsApp messages saying Cuban doctors have developed medications, vaccines, and so many things. It's all fake message. So people are sending lots of fake news. This particular photo, which was circulated in WhatsApp as saying vaccine or medication, is really the test kit. That's a test for COVID-19. That's called the antibody test, which is again not yet been released. If you develop an antibody, it could be easily tested, like easily used by general public. It has not yet been approved. That antibody test might come very soon. If that comes out, people would be able to find out whether they have got infection. Also, they can find out whether they have already had the infection. So that will be quite useful for healthcare workers rather than the public. However, we should remember that these photos that are circulated in WhatsApp are not medications. It is a test kit. That is a testing kit.
There are again 2 questions coming from through the studio. This is one is a controversial question. It's about is this virus man-made or it just naturally happened? Probably it's a bit difficult to answer. I don't know whether you have some extra knowledge than myself at this time.
I don't want to go into controversy talking about these theories. A lot of people talk about conspiracy theories. In every problem, whether it's a war or infection, there'll be lots of conspiracy theories. Some may be correct, who knows. But we should, for as medical professionals and the public, our problem is whether it's man-made or a conspiracy, who made it, how it happened, we are facing it. That's all. So we had to face it. We had to find a treatment for this. We had to settle this down. So we have to take the standard measures. So
Excellent.
that
It's a
is
good
prevention, social isolation, hand washing.
Excellent.
And if you are ill, get into the hospital. That's whether it's made by somebody or naturally happen, it doesn't matter for us.
Dr. Naser, we're going to get a call. There's a call online. Hello. Hi.
Hi, can you hear me?
Hi, yes. You're connected. You're online.
Right. At first, I need to give a special thanks for arranging this program so that we can ask about related questions. So my question is that recently I received my mother-in-law. She came from Bangladesh, and
can you talk a bit louder?
Can you hear me now?
Yeah, that's better.
Right.
Yeah.
Recently, I received my mother-in-law from Heathrow Airport. She came from Bangladesh, and when I just received her and came to home, after that day, is that clear? Line is clear. I'm a little confused.
Hello, please. Yeah, go ahead.
Yeah. So when I informed my office about that, I went to receive my mother-in-law from airport, and she came from Bangladesh. They advised me to stay at home for 14 days for self-isolation. I appreciate that, the way they given that safety moment for me to be safe. My question is that if I'm staying with home with her, and if in case she's affected with that, with the coronavirus, so is that safe for other people like those are staying at home with her? So in that case, what safety measure we can apply to save? If anybody be affected by the coronavirus at home, for the other people who are just sharing the same home, what they can do to be safe? That is my question.
Thank you very much. Dr. Naser, did you get the question?
Yes. Can you repeat that question? If you can just briefly tell me.
If you could tell it in few words, we will try to get an answer for yourself.
Hello?
Hello, yes. Can you repeat the question in short format, please?
All right. My question is that if anybody unfortunately be affected by the coronavirus at home, so for the other people who are sharing the same home, staying in the same home, same house, how they can protect themselves, because same home, same.
Oh, okay. Yeah, we get the question.
I think I answered that question before. Anyway, I'll just quickly repeat that. If somebody in the house is infected and was suspected as having coronavirus infection or COVID-19 infection, all the family members should be self-isolating, or we can call it quarantine, for 14 days. And if the person is having symptoms, and that person should be isolating in a room in the same house, he shouldn't be interacting with the family members, especially if they are elderly people. They should be separated, or if you could move them out of the house, they should be moved to some other place. If you can't move them, you should be isolating them in another room separately. So if you want to get full details about how to self-isolate yourself, there is a nice video done by BBC. You can search on the BBC Online or YouTube. You find a nice video about it, how to self-isolate yourself. So the summary is, if somebody is found a family member is found to have symptoms, that whole family should be isolating themselves for 14 days, and that person, the person with symptoms, should be in a room and should not be interacting with others.
Dr. Naser, I'm going to take a quick call from a Facebook user, and
Yes.
apparently there is a fear going on that people who got symptoms of this infection, like fever and sore throat like this, and they are afraid to go to the hospital. What would you say about this? or are they afraid to call the emergency line? What is your advice for them?
Yeah, I'm talking about this. This is about the UK situation. If somebody outside UK is listening, the guideline will be slightly different. If you're in UK, if you have got sore throat, headache, fever, aches and pain, or any other sort of, sometimes some people rarely would have abdominal pain and diarrhea. So that's very rare. So if you have those symptoms, you don't need to call the 111 or your GP. You don't need to go to the hospital. What you need to do is to self-isolate, take some paracetamol, enough fluids, a balanced diet. So otherwise, you don't need to worry. However, if you think your situation is worsening, you're becoming more short of breath, you are developing a cough which is not uncontrollable, lasting sort of bouts of cough more than for about an hour, or you think you can't cope with the situation, that means you are becoming more and more ill, then you should call 111. They would advise accordingly whether you should go to the hospital or not. Generally, the fever settles down in 5 days, and with some paracetamol. Usually, most people would be all right by 7 days. So after 7 days, if you continue to have fever, then you should definitely seek medical advice. And if you anytime become more short of breath than normal, then you should immediately seek advice. If you are a diabetic patient, your blood sugars are high, say blood sugars are 18 millimoles, 20 millimoles, even if you have, say, 2 days of fever, you should still contact the doctor or the NHS 111. And if you are pregnant, there are clear guidelines in Royal College of Obstetricians website. So what to do? It will be slightly different to normal people. You can call 111 or you can go through the internet page of the Royal College of Obstetricians. So for general people, you should stay home and take some paracetamol if you need.
Shall we quickly go through the current statistics? What's happening in UK and around the globe with this new crisis with COVID-19?
Yeah, around the globe now in US they are doing so many tests. They're doing more tests than any other country, and therefore they seem to be having more numbers. If you test more, you will find more people. However, death rate also seem to be quite high in US, so therefore the conditions seem to be worsening there. The Italy seem to be settling down. However, still they're having very high deaths. Spain is still having increased number of cases. UK, if you look at yesterday's admissions or diagnosed cases, the number of cases seem to be flattening. However, we can't be assured. If the number of cases are sort of settling or a curve is flattening, that tells us this social distancing seem